This video describes the many forces influencing the direction of the University of Minnesota School of Nursing from 1929 to 1940. It's divided into two parts. Part 1 describes how the decade was greatly influenced by two events, the Great Depression and the publication of the seminal national study on the grading of nursing schools. It also describes the appointment of Katharine Densford and the structure of the school and its curricula. In Part 2, we show how, under the leadership of Katharine Densford, the school responded creatively to the contemporary challenges, while at the same time clinging tenaciously to the core values that led to the creation of the school in the first place. Among the earliest and most influential developments within this time period was the appointment of Katharine Densford as director of the school in 1930. A brilliant leader with vision and tireless energy, she would lead the school for the next 29 years, creating a strong academic program for nursing in Minnesota and throughout the nation. Densford began as a history and Latin scholar, but the outbreak of World War I convinced her that she could be of more use as a nurse. After a number of years in traditional practice, she changed her focus in 1925 from nursing practice to administering nursing services and schools of nursing. When Densford came to Minnesota, most nurses earned diplomas in hospital-based nursing schools. Graduates of these hospital schools worked in hospitals as superintendents or head nurses in public health, or they went into private practice in a patient's home. In private practice, they earned $15 to $25 per week. They worked around the clock with time off only at the convenience of the family. As the economic crisis of the Great Depression deepened, fewer private duty nurses were employed by families who could no longer afford them. Care of the sick moved from the home to the hospital, but for financial reasons, only a few hospital school graduates were added to the hospital nursing staff. Most of the care in hospitals was provided by cheaper, untrained attendants and by student nurses. It soon became clear to the doctors and administrators that student nurses provided care that was superior to that of the untrained attendants. Recognizing the superior care by student nurses, physicians began lobbying hospitals to establish still more nursing schools. For a time, the number of hospital-based schools grew rapidly. Unfortunately, not many of the graduates found employment. The need for more students to provide care in hospitals and the decline in the number of private patients for graduate nurses led to a large number of unemployed hospital school nursing graduates and a great surplus of trained nurses. So most nursing education in the 1930s was based on the Apprenticeship Model. Nursing students were trained on site in the hospitals, with hospital staff serving as trainers. During this apprenticeship, students were unpaid except for room, board, and a small stipend. Student nurses were the most economical caregivers and were even assigned as head nurses on occasion. But the Great Depression brought about more change. Within a short period of time, hospital school nursing graduates began to replace nursing students in hospitals because nursing graduates provided even better care than the students had. The Depression produced lower salary rates, and hospitals were then able to afford hospital nursing school graduates in larger numbers. Between 1926 and 1934, surveys of conditions in the field of nursing education and practice were conducted over an 8-year period by the big nursing organizations. Joining these 3 nursing organizations in the study were 3 medical, surgical, and hospital organizations. This committee on the grading of nursing schools put together a comprehensive nursing schools report, which was published in 1934. This landmark report identified the deficiencies in nursing education. A similar study of medical education, the 1910 Flexner Report, identified deficiencies in medical education, which resulted in an overhaul of medical education and healthcare services. The proliferation of nursing schools and hospitals led the committee to conclude that too many of the hospital graduate nurses in the U.S. had mediocre training and background. The most serious weakness in hospital schools of nursing were too few good teachers and not enough emphasis on good nursing care. The nursing school's report specified the essentials for a basic professional school, including a sound theoretical base, correlation of theory to practice, and reductions in work hours to ensure students had time to devote to their professional studies rather than staffing the hospital. Also considered essential were adequate teaching facilities, student housing, strong admission criteria, clinical experiences across the lifespan and from prevention to the end of life, and educational credentials for faculty and administration. The report stated that without changes in the near future, large numbers of new nurses would receive inadequate education. Ms. Densford took the recommendations of the 1934 Nursing Schools Report very seriously. Her chief objectives as she began her tenure were to maintain the high standards already established at the University of Minnesota, to build up a faculty of superior academic achievement, and to reform curricula in acknowledgement of the increased responsibilities of the nurse. At the beginning of Katharine Densford's tenure as director, two programs were running simultaneously: the 3-year diploma preparation and the 5-year licensure preparation with a baccalaureate degree. Back in 1909, the University of Minnesota Nursing School curriculum was like that of most advanced 3-year hospital programs, such as those based on the model established at Teachers College, Columbia University. The School of Nursing at the University of Minnesota made several enhancements to this model of instruction. The nursing school benefited from its association with a medical school so that physicians could provide classroom instruction when there were few nursing faculty. It had highly selective admission criteria, including the requirement that applicants have high school diplomas. Physician faculty delivered lectures on the clinical topics, and nurses taught the practice classes. But in 1919, the School of Nursing added courses in the sciences and liberal arts to the nursing curriculum. Applicants were required to earn 75 non-nursing university credits before entering the nursing school. These changes created a 5-year curriculum that reassured the faculty that it was on par with other majors within the university and deserved a baccalaureate degree. These developments led to the programs Katharine Densford inherited when she began her tenure. Consistent with the nursing school's report, Densford believed developing a strong faculty should be considered first in her efforts to build a quality nursing program. Densford inherited a faculty of 2. Lucille Petrie was the principal teacher and supervisor, and H. Phoebe Gordon assisted her as the counselor and secretary. The annual budget was $4,860. Ms. Densford set her criteria for hiring faculty to include integrity, aptitude for scholarship, sound educational preparation and experience, and ability to grow in 5 years. Within 3 years, the School of Nursing had 5 instructors who were nurses and had baccalaureate or higher degrees. At that point in time, only 25% of schools of nursing in the nation had 2 or more nurse instructors, and only 27% had nurse instructors with college degrees. The nursing faculty came from strong backgrounds and initiated innovations in nursing education rare in other schools. A leading concern of Ms. Densford was the development of students as educated professionals and productive citizens with strong minds and bodies. She assigned Phoebe Gordon as a full-time counselor to help promote these goals. Gordon is believed to be the first such counselor in a nursing program. Students were encouraged to participate in university extracurricular, recreational, and social activities, such as entering a float in the university homecoming parade. To foster students' participation as productive citizens in the community, they were encouraged to become involved in student government and were asked for feedback on curriculum change. Students regularly attended national and international nursing conferences. The student body was composed of women and reflected the dominant white population of the time. In 1929, Francis Mary Mackay, an African American, applied to the School of Nursing and was denied admittance, stating as reasons that students of color were not allowed to live in dormitories and there were no hospital wards for patients of color where she could complete her nursing educational practice. The Minnesota legislature intervened and approved the petition for admission, and Miss Mackay became the first African American nurse to graduate from the School of Nursing in 1932. The second African American nurse, Teresa Venita James, graduated in 1933. These two alums practiced in nursing education and administrate for many years thereafter. In this video, we described how the Great Depression and the national study on the status of nursing schools influenced the developing University of Minnesota School of Nursing. Katharine Densford and her colleagues, important leaders in nursing education, accepted the emerging needs of the era and modified the nursing program to better meet the challenges posed.